Okay, and we have Anita up. Anita, do you have a question for Dr. Anita?
Can you hear me?
Yes, I can. Go ahead, please.
Okay. What is a left lower pole cyst, and what kind of complications can you derive from that?
I'm sorry, I didn't hear the last part of your question. If you could repeat that, please.
What is a left lower pole cyst on the kidney? What kind of a problem would that create?
Oh, I see. The question is, what is a cyst of the kidney, actually?
A left lower pole cyst.
Yes, ma'am. Yes, ma'am. Certainly, I would be branching out of my area of expertise to talk too much about cyst of the kidneys. I certainly deal a great deal with cyst of the ovaries. I will say that cysts in the kidneys are things that we often encounter as part of the evaluation with ultrasound, with CT scan, or with MRI scans when we're looking for a source of pelvic pain. But I don't think you'd be well served by me speaking to kidney cysts. For that, you would really want to see a general surgeon or potentially a urologist.
Okay, thank you.
Certainly.
Thank you very much, Anita, for calling. Up next, we have Lynn. Lynn, go ahead with your question for Dr. Stroud.
What is an endometrial biopsy, and why is it ordered in relation to uterine cancer? Trying to figure that out.
Sure, very good question. Not necessarily particularly related to pelvic pain, but could be, and an important question nonetheless. An endometrial biopsy is just that. It's a biopsy of the endometrium. And the endometrium is the lining of the inside of the uterus. It's that portion of the uterus that sheds each month with menstrual flow. A cancer of the uterus is, in fact, a cancer of the endometrial lining. So when we want to evaluate for the presence of endometrial cancer, we sample that tissue with an office procedure called an endometrial biopsy, and that gives us our answer.
Thank you very much. And up next, Susan, you have a question for Dr. Stroud.
Yes, hello?
Yes.
I'm not sure exactly why, but after I had the baby, I breastfed for like a year, and I was told that would make like underwear painful because it's really dry and anything can irritate it. But I haven't been doing that for about 3 months, and they still hurt. I don't know, when I wear jeans, it hurts and they're not that tight. I don't understand. Any idea?
Are you talking about pain or discomfort from your bra or from your underwear?
Oh, for my underwear.
Yeah. I'm not sure why that would have been related to you, related to breastfeeding as a cause of discomfort. I think the best I could do probably was to say you really should have that discomfort evaluated. It certainly could be an allergic reaction, certainly could be a yeast infection, as we were talking about earlier. I don't think that I could, at least based on what you've said, make a connection to breastfeeding, but it's something that you should have looked into.
Okay, thank you.
Thanks very much. And on that topic, is it common to have pain after a baby is born?
Sure, good question. Yeah, I think anyone would say that has had a baby, they had some degree of discomfort afterwards.
Yes.
And it sort of gets back to the thing that we talked about earlier. What's a normal amount of discomfort?
And for how long?
And for how long?
Yes.
You know, it's very common to have some discomfort in the pelvis for as much as 4 weeks, even sometimes as 6 weeks. And it's something that when we talk to patients about that, we should be able to determine that it's getting better, their pain is getting less and less intense, and having less of an effect on them over time.
Good. That sounds great. Up next, we have Anna. Anna, your question for Dr. Stroud?
Hi. I have 2 questions. First, I am 30 weeks pregnant, and the baby, sometimes she pushes down on the bladder very hard, and sometimes it hurts. Is that normal?
Did I hear you correctly when you said 30 weeks pregnant?
30, yep.
You know, I would have to say if we polled everyone in the community that was 30 weeks pregnant, I'll bet we'd find a lot of women that said they were having some degree of discomfort. If you think about it, at 30 weeks, there's not a lot of extra room left in the pelvis or your abdomen. Things are getting pretty crowded, and they can get pretty uncomfortable. We certainly hear a lot of patients talk about pain in their bladder towards the end of pregnancy. We often imagine perhaps the baby is kicking the bladder, and that can cause a bladder spasm. Certainly we talk about ligament pain towards the end of pregnancy after 30 weeks and beyond, where the ligaments are becoming stretched as the uterus and the baby increase in size. But I would have to say it's pretty common to have some degree of discomfort in the end of pregnancy. Again, as we've said with other things, if you feel as though it's not getting better, it's getting more intense, or it's causing you significant problems, it really needs to be evaluated by your obstetrician.
Okay.
Anna, did you have another question too?
Yes. Another question is about vaginal discharge. Is this supposed to be clear, or, what color do I have to look for danger signs of anything like that?
Sure. I assume you're talking about a vaginal discharge in pregnancy. And there is what we refer to as a physiologic discharge of pregnancy, that the hormones of pregnancy and some of the other changes can make much more intense. That typically is a clear discharge. It typically is not foul-smelling, but it can be a great deal of it, a large volume of discharge, and that can be perfectly normal. The things that we watch out for is it foul-smelling? Is it something other than clear or white? Is it causing severe itching or burning or other kinds of symptoms? The other thing that we think about is the rupture of the membranes or the breaking of the water in pregnancy. And that typically is associated with a large gush of fluid that just continues slowly over time.
Okay.
Anna, do you have any other questions, or did Dr. Stroud answer to your agreement?
Yes, everything went fine. Thank you so much.
Thank you very much, Anna.
Thank you.
Up next is a caller who would like to remain anonymous. Go ahead, caller. Caller?
Yeah.
Hi, go ahead for your question. Can you hear me?
Hello?
Hello, we're on Docs on Call, and go ahead with your question for Dr. Christopher Stroud.
Yeah, I was wondering why Fort Wayne community schools aren't closed yet.
Well, that's a good question. I'm not sure I can help you with that question, though, with regards to Fort Wayne Community Schools. I'll have to defer to you. Maybe you have...
I know. I used to teach at Fort Wayne Community Schools, and they will let you know about 4:30 tomorrow morning. Thank you very much. Okay, up next we have Pam. Pam, do you have a question for Dr. Stroud on pelvic pain, even?
Yes. Can you hear me?
Yes, I can. Thanks.
Hi. Yes, I'm 51 years old, and I didn't have a period for almost a year. And then all of a sudden I came on last month, and I've been on for like 40 days straight. Went to the doctor. She gave me some Pervera pills. They're supposed to stop the bleeding. But when I'm reading the instructions about these pills, they cause cancer in a lot of places. So I'm wondering, how long should I take these, and why should I bleed for 40 days straight?
Sure. So really a lot of good questions sort of wrapped up into one there. It's very common for women who are, as we say, perimenopausal or around menopause, to suddenly start bleeding after having stopped bleeding for some time. And it's very common as well when that bleeding starts that it's what we call dysfunctional or abnormal. So instead of being maybe a 4 to 7 day menstrual bleed, it may be elongated and start and stop and start and stop, or in your case it sounds as though it went 40 days without stopping. Usually that's a hormonal phenomenon. That's why we call it perimenopausal bleeding. As the hormones produced by the ovaries are beginning to change, it can cause a change in the bleeding pattern. Using the drug Pervera, which is a brand name of progesterone, can stabilize the lining of the uterus and make that bleeding stop and return to a more normal period. Pervera is a very commonly used medication that we in OBGYN have used for many, many years, and I'm sure your physician was very comfortable prescribing that, and that's why they did.
Pam, do you have another question, or does that answer your question with Dr. Stroud?
Yes, that answered my question. Thank you very much.
Thank you, Pam, for calling. Up next we have Lauren. Lauren, your question.
Hi, I just got an IUD put in not too long ago, and I'm having extremely bad pain in my right side. I don't know if I need to go get my IUD checked out or if that's normal. They said that there was going to be some cramping, but it's extremely bad sometimes. It comes and goes. It lasts for about 10 seconds. Sometimes I don't have it all day, and then I'll get it the next day really bad, and I don't know what to do.
Sure. If I could ask, how long have you had your IUD?
20 to 25 days, I'm thinking.
Sure. So really, you're in the first month since it's been inserted. I'll say that it's not uncommon to experience some intense menstrual type cramping initially after the insertion of an IUD. You're coming up to the point where I would expect that to be resolved. And if it persists much longer, and I'm concerned that you use the word severe, I think that I would get back to my physician and have that evaluated. It is possible with the insertion of an IUD to cause some inflammation, and that inflammation can lead to pain and discomfort. It is also possible that you have some other process going on that's unrelated to the IUD. But one of the takeaway points I hope for this discussion tonight is that pain that persists and that's significant needs to be evaluated.
Okay, thank you.
Thank you very
Thank
much.
you.
We're talking about pelvic pain, but what about if a person doesn't have a pain? I'm thinking ovarian cancer. Does that present itself with pain?
You know, unfortunately, Elizabeth, it does not. In many ways, it would be great if ovarian cancer did cause pain, because then we would find it so much earlier. The biggest challenge we have with ovarian cancer is that in the overwhelming majority of cases, we don't discover it until it's in its later stages. But pain is not an associated symptom with ovarian cancer.
We talked about so many things. I felt as though I was listening to your doctoral thesis, just a myriad of topics tonight. Give us some more takeaways.
You know, one of the callers, I think, really pointed out in that pain needs to be evaluated. It's never normal to hurt. And so if you're having symptoms that are disruptive, that are causing you to miss work or miss activities, that require medication, it needs to be evaluated. I think, too, just because we can't diagnose the exact cause of your pain, it doesn't mean your pain's not real. It doesn't mean there's not something we can do to help it. It doesn't mean the pain is in your head. After all, we're saying it's in your pelvis. So that's not to be discouraged. If we can't give you an exact cause of the pain, it still can be helped, and we can still work with you to address that. I think also pain can be the symptom of something much more serious, in some cases life-threatening underlying conditions. So again, pain needs to be evaluated.
And when a woman calls and says, I have pain, I'd like to see a gynecologist, how do you treat that? And how do gynecologists treat it? Do they take pain seriously?
Well, I certainly hope so. They certainly should, because it's, again, as you mentioned earlier, as many as 1 in 5 visits to gynecologists in America are related to some form of pain. An important takeaway, I think, from this discussion is to be successful in treating pelvic pain, you need a partnership with your physician so that you can have that discussion and the two of you together can work out a strategy that's going to address your particular pain in your particular circumstances.
Dr. Christopher Stroud, thank you. You have educated us all very much, and I look forward to your next time here on Docs on Call. Thank you for being with us this evening, this snowy evening.
Thank you. It's been my pleasure.
Oh, and it's mine too. And thank you very much for joining us on Docs on Call. Next Tuesday, Lee Kelsel will be talking to Drs. Bodrab and Hatch from Pain Management Associates, and next Wednesday I'll be talking to Dr. Norland from Contact Laser Institute. Until next time, thank you for joining us.